Hello, friends. Today I want to talk about a muscle whose persistent tightness causes localized pain in the hip area, increases joint pressure, and accelerates the development of coxarthrosis. I will also show you a complete exercise routine that helps slow down the progression of arthrosis and reduce pain levels. Let's begin with anatomy. Understanding the precise location of this muscle is essential because it improves accuracy and effectiveness of self-massage. The gluteus medius muscle lies on the lateral side of the pelvis. It originates from the iliac crest, travels downward, and attaches to the greater trochanter of the femur. Unlike surrounding muscles, it is not fully covered by the gluteus maximus, which makes it easily accessible for treatment. This muscle is responsible for many important actions: hip abduction, internal and external rotation, and extension at the hip joint. It starts working the moment we get out of bed in the morning. Because of this constant workload, it often forms trigger points, local areas of chronic tension that generate pain. How the symptoms show up. In most cases, gluteus medius dysfunction causes pain directly around the hip joint. The pain may feel superficial or deep inside the pelvis. Typically, it is dull, aching, or pulling in nature, but during sudden movements or when lifting heavy objects, sharp stabbing pain can appear. Very often, the gluteus medius produces referred pain upward, radiating into the lower back, sacrum, and coccyx area. Many people spend months treating the lower back with massage or physiotherapy but receive no improvement because the actual source of pain lies elsewhere. This is a classic example of referred pain, when the painful impulse comes not from where discomfort is felt, but from a different region. When this muscle shortens, the pelvis tilts backward. This reduces the normal lumbar curvature, lordosis, and instead creates flattening of the spine. As a result, pressure on the intervertebral discs is distributed unevenly, causing bulges, hernias, and degenerative changes in facet joints. At the same time, the gluteus medius compresses the hip joint, increasing friction inside it. Over time, the cartilage cracks and wears out, leading to coxarthrosis. Therefore, working with this muscle not only decreases pain in the hip, sacrum, and lower back, but also protects your spine and hip joint for years ahead. Lifestyle modifications. While restoring this muscle, it is important to eliminate daily habits that worsen its condition. For example, when you lift heavy objects, always stand evenly on both legs. Do not shift your body weight to one side. Sitting in the same position for a long time slows blood circulation and tightens the muscle even more. Stand up every 30-60 minutes, walk briefly, stretch, or move your hips. Avoid sitting with one leg crossed over the other. If you do, alternate sides or sit symmetrically. People who constantly carry a child or heavy bag on one side develop excessive muscle overload on that side. Redistribute weight evenly. During the healing process, avoid high-impact activities such as running, football, volleyball, basketball. These sports increase compression in the hip joint and intensify cartilage damage. First, reduce inflammation, relax the muscle, and restore mobility. Then return to sports gradually. How to locate the muscle. Place your fingers on the lateral part of the pelvis and find the firm bony crest. That is the iliac ridge. Slide your hand slightly downward. This soft area is where the gluteus medius is located. If you shift your weight to the opposite leg, you will feel the muscle contract under your fingers. Below that, you can palpate another bony point, the greater trochanter of the thigh bone. The space between the crest and the trochanter is the exact projection area that needs to be treated. Self-massage techniques. You can use a firm massage ball, your fist, a foam roller. Apply pressure slowly and gradually. Place the ball on the painful area and press it against a wall. Move your body slightly up and down or side to side, searching for tender points. Areas that feel sharper or more painful should be worked more deeply. That is where trigger points are located. Using your fist works similarly. Place the knuckle area over the muscle, shift body weight to the opposite leg so the muscle softens, and then apply pressure using your other hand. A foam roller is helpful while lying on your side. You can roll along the muscle fibers or across them. Move slowly and pause on sensitive areas. Stretching. After releasing the tension, lengthening the muscle is essential. Sit with one leg straight, cross the opposite leg over it, place both hands on the outer surface of the bent knee, and gently pull it toward the opposite shoulder. You should feel stretching deep in the gluteal area. Hold this for approximately 1 minute and repeat 2 to 3 times. Time recommendations. Self-massage should last at least 5 minutes. If the muscle has been tight for a long time, increase up to 20-30 minutes. Stretching should include 2 to 3 holds of 1 minute each. At the end, apply heat, either a warm shower or heating pad. Heat increases blood flow and allows the muscle to relax more deeply. Thank you to everyone who supports the channel. Follow this routine consistently and stay healthy.